Really quickly, thank you to everyone who has taken the time out of their day to come to my presentation today. It really means a lot to me and I really appreciate it. Really quickly, hi everybody, my name is Agatha Shi and I am going to be a rising freshman at the University of Southern California this fall. Recently, I just graduated from Irvington High School, which is in Fremont, California, here in the Bay Area. And as a senior, one of our year-long projects is called Quest. And in Quest, we choose a social issue, and then we research various aspects of it, as well as conduct our own service and try to find some way to help alleviate the issue. So for me personally, I chose to do my project this year on the barriers to accessing mental health care among Asian Americans. And I chose to do this topic because I personally have my own experiences with it, and I've kind of also seen it within the trend among my community and my friends as well. I remember seeing an Instagram post the beginning of senior year, which went somewhat along the lines of how Asian American students have some of the highest rates of anxiety and depression at top performing universities, but at the same time, they're also the less likely to use mental health services. And it seemed very paradoxical at first, but then if I were to really think about it and think about how my own experiences here in the Bay Area, I could kind of also relate to it. So I really wanted to do a little more research on it and see what was its basis and how we can help alleviate this issue. So before I begin to the bulk of my presentation, I do wanted to thank a few people. So first of all, I wanted to extend a special thanks towards Ingrid Chung. She's actually not here today, but when I was doing my whole project, she met up with me weekly. She gave me a lot of advice and was always checking up with me if I had any questions. I also want to thank Emily, and she is here today. So thank you so much. She really directed me and helped guide me through what I wanted to do after my senior year was over. And finally, thank you to Isabel. She really coordinated the logistics and helped to make this happen. And finally, a big thank you to everyone coming today. At the beginning of my project, I really did not know which direction I wanted to go. So I had an essential question that kind of really directed me, and it went something along, how does Asian and popular culture shape how people, both inside and outside the Asian American community, view receiving mental health services? What are the similarities and differences in alleviating the strategies to alleviate the issue on both sides? A lot of the times when we think about kind of these barriers to mental health, at least for me and a lot of my friends that I did ask, we instantly thought about culture and like it being taboo and it being very stigmatized. And while that is a very big part of it, there are also other aspects of it which is in more popular culture, more part of general society that we often tend to overlook. Really starting with a quick introduction to the social issue. So the term Asian Americans and Pacific Islanders refers to the demographic group of Americans with Asian roots or roots in the Pacific Islands. And it's also very important to note that this community is very diverse, consisting of multiple subpopulations of people that can be based on a variety of things from religion, culture, ethnicity, etc. This is also very important to note because often when we think about Asian Americans, we tend to immediately think about the larger demographic groups, perhaps like Chinese Americans, Indian Americans, Japanese Americans, and we may overlook smaller populations such as maybe Mongolian Americans, Burmese Americans, and so on. And we don't want to do that because they are equally as important. However, one general trend that does seem to span across the demographic is that Asian Americans do tend to be the least likely to seek out mental health help. And as a result, this leads to an underutilization of mental health services. And because Asian Americans tend to use less of these services, a general society has this misconception that a problem does not exist. And in fact, this is not true, and often it can have pretty harmful effects. So moving on to scope and severity, a little background on the Asian American population itself. So Asian Americans are actually the fastest growing racial group, growing by about 72% since 2000. Right now, they make up approximately 6.7% of the US population, which is about 22.2 million people. Of that 22.2 million people, only 15% will explicitly participate in mental health reporting. And according to the Office of Minority Health, Asian Americans who do report having psychological distress, that number is only 0.6 times the psychological distress reported by non-Hispanic whites. going a little deeper into Asian Americans themselves, if you see from the top infographic, which is a chart taken from the Office of Minorities Health Statistics on Asian Americans, we can see that all Asian Americans groups tended to report lower levels of psychological distress. So for the age-adjusted percent distributions, all whites reported an average about 2.9, while all Asians averagely reported about 1.9, with different numbers broken down here. But as you can see, they're all in general less than 2.9. This issue also affects different generations. The first generation compared to second or third do have different barriers that might affect them more than others. And I'll talk a little bit about this later on. This issue also tends to span socioeconomic class because the Asian American population does also span socioeconomic class. In general society, there's this kind of a belief that Asian Americans tend to be higher on the socioeconomic scale of class. And while some data statistics does support this, for instance, such as if you were to look at data released by the Bureau of Labor, you will see that in general, overall statistics tend to be higher, but it is also very important to note that this is overall statistics of an average. And if you do take an average, you tend to skew data and you tend to overlook outliers. So as you can see in this bottom slide, which is taken from the American Psychiatric Association, even though there's this kind of stereotype that does exist, Asian Americans also tend to have a lower percentage who have insurance, and also a higher percentage of people who are uninsured. Really quickly, I just wanted to address, I will be sharing these slides afterwards. So yeah. So actually moving on to the severity itself, Asian Americans are actually 3 times less likely to seek help as compared to their white counterparts. So if you were to put this into the scope of the whole population percentage-wise, 18% of the US population sought mental health services versus about 8.6% of the Asian American population will do so. Asian Americans also tend to be less likely to use prescription medication or treatment for depression. However, not just in receiving treatments, Asian Americans also tend to not participate as much in mental health reporting. So this leads to a lot of lower official numbers, which can kind of explain from the previous infographics on those slides of why there's a lower ratio for Asian Americans as compared to all whites. However, this issue does disproportionately affect some certain groups as well. Here are just some of them that I pointed out. So the Office of Minority Health also reports that for Asian American and Pacific Islanders youth from 15 to 24, the leading cause of death in 2017 at least was suicide. I double checked again yesterday, and they have also confirmed, at least what was publicized by the government, is that it was also the leading cause of death in 2019 as well. Southeast Asians also tend to report a higher level of psychological distress, especially those from the Philippines and Vietnam. And this has been attributed to trauma, especially from immigrants or refugees and having a hard time adjusting to a new life here in the US. It also disproportionately affects the first generation, who tend to be a little less willing to use mental health services as compared to subsequent generations. This may be due to additional barriers such as language or distrust of the government. Moving on to the consequences. So I personally split the consequences between mental illness patients themselves and then the Asian American community. So one of the major things and one of the most concerning is that it can lead to ineffective treatments. Asian Americans tend to turn to a primary physician more than a mental health specialist. And while this may be helpful, a primary physician may not necessarily have the resources, the education, or the specialty as compared to a mental health specialist. Because barriers make it difficult to access services, people may turn to personal treatments, for instance, such as religion, yoga, meditation, herbal medicine, etc. And while they may be helpful, especially for some people, they may also not be helpful for others. And sometimes it may actually cause more harm than good. Another major consequence is that it leads to denial of treatment. Because barriers make it hard to access services, in the time being that Asian Americans don't have these services, mental health may continue to deteriorate, so that when Asian Americans actually do receive the services that they might need, they present with often more severe symptoms and are less likely to see improvement in typical bouts of psychotherapy as compared to their white counterparts. For the Asian American community itself, it creates a kind of a false belief. So when Asian Americans don't use these services, general society kind of sees these lower statistics of service use and believes that Asian Americans don't suffer from mental health issues. However, this is not true. But then general society believes that general society believes that Asian Americans don't suffer from these issues, and the issue is therefore often unacknowledged and no policy or action is often taken. So for example, you can take the National Institute of Health's research budget. Although this is not specifically tailored to like mental health research, it can kind of give you what we're working with. So from 1992, the National Institute of Health's research budget that has been allotted for Asian Americans and Pacific Islanders has only been about 0.17%, compared to that with how much Asian Americans make up the population, which is about 40 times more than 0.17 at 6.7%. There's quite a discrepancy between how much money is allotted and how much Asian Americans and Pacific Islanders actually make up the population. Lastly, it contributes to quite of a negative point of view. When someone within the community tries to seek help and is unable to do so, it kind of sets an example for someone else who may be watching them and convey to them that seeking help is not an option for them. So now moving on to the causal factor itself. One of the most things that we do think about is culture and the stigma that comes with it. When I was doing my research, someone pointed out to me that some East Asian cultures tend to be shame cultures. And that just simply means that there's an extra emphasis on the idea of pride and honor and kind of how other people view you. And sometimes having mental health issues or seeking out mental health help is seen as something that can be shameful and take away that pride and honor. Some Asian cultures also tend to be collectivist cultures that emphasizes the whole family. So even if an individual feels comfortable with seeking help, they may not do so in order to prevent losing the face of the whole family. Losing face is a concept that is not very much seen here in America or in the Western world. It's typically something more you see in East Asian culture. So it is something that might be a little harder to understand. Another interesting point with collectivist cultures is that oftentimes many people think of mental health as something that should be handled within the family. And therefore people should not really go outside the family, go to hospitals and physicians to seek help. Another idea is that a lot of Asian culture draw ideas from Confucianism teachings. And one major aspect of Confucianism teachings is this ability to take care of the family. And Dr. Jeffrey Liu from the McLean Hospital has quoted that when someone has mental health issues or tries to seek help for it, it quote unquote brings the ultimate form of shame as it takes away that ability. This then leads to stigma around the issue. People do not want to talk about it and it becomes a taboo topic. And this perpetuates a lack of knowledge around the community, as when people do not want to talk about an issue, it is constantly avoided and not much new is learned about it, and we are unable to break down those walls. Another major cause is simply in accessing care. So not a lot of services are actually tailored to Asian Americans. For example, questionnaires that measured racial prejudice, not specific, one that's not, even in the medical industry, a lot of them are tailored more to the experiences of African Americans rather than Asian Americans. However, Asian Americans and African Americans go through very different experiences, and the questions that may be asked may not necessarily get information that will be helpful. Oftentimes, there are also different perceptions of things such as severity. What one group might perceive as very severe in need of medical help right away, Asian Americans may not necessarily feel the same way. For example, I personally took health class in my freshman year of high school, and I remember doing a very brief lesson on mental health and how the teacher really emphasized if you feel only even slightly off, you can tell if you're an athlete, you can tell your coach and they will go a little easier on you that day. You can always talk to someone about how you're feeling. However, within my peers and kind of even with my parents as well, a lot of the times those same feelings are kind of dismissed, kind of like you can sleep it off, it's just something that you're feeling for the time being. In America, there also tends to be a shortage of bilingual and bicultural services. It's not so much here in the Bay Area because we tend to have a pretty high Asian American population, but this is especially prevalent in rural parts of America. These call services range from simply having pamphlets in different languages or physicians who can speak multiple languages. When these do not exist, it leads often to ineffective treatment because physicians may not be able to communicate the treatment across properly, or a patient may not feel comfortable talking to someone who doesn't speak the same language. Various other structural barriers also occur, such as simply the high cost of healthcare, a lack of insurance, geography, and not having transportation to get to a hospital. I'm sorry. Okay. Another major cause is stereotypes, and the one that we mostly think about is the model minority myth, which falsely assumes that all Asian Americans are high achieving, obedient, and well assimilated. By elevating Asian Americans, it downplays the effects of racism, and oftentimes Asian Americans will not get the policies the support that they need for a lot of issues such as this one. Even within the Asian American community, there is a push to live up to that myth. Within my own friends and family, my community, there's this idea that kind of keep your head down low, do what you're supposed to do. Don't make quite a big of a scene to kind of be the perfect minority. There's also the perpetual foreigner stereotype, which states that Asian Americans are basically perpetually foreigners. They can never fit into American society. And what this stereotype does is that it alienates Asian Americans from general American society. It creates this barrier that makes people feel as if Asian Americans aren't Americans. And this may create a racial bias that can lead to discrimination from preventing Asian Americans from receiving the same services. Another major cause, which I actually didn't think about, none that didn't really come out when I was actually thinking about in the beginning, was trauma. So this may especially affect like first generation immigrants and refugees who are adjusting to a new life after their journey from their home country to the United States. Some also suffer from historical trauma from past wars or colonization. So a lot of soldiers may have post-traumatic stress disorder and therefore kind of not want to seek treatment in order to not relive that horror again. Younger generations who do have connections to older generations who have experienced trauma, like perhaps their grandfather fought in World War II, or their parents went through a really hard time getting from their home country to the United States, may feel as then if their mental health struggles are insignificant and may deterred from seeking help. At this time, I do wanted to kind of shift from the causes and introduce an expert interview that I conducted with Dr. Gordon Hall. So after the beginning half of my presentation, a lot of the information came from reading a lot of scientific texts, from a lot of research articles, from hospitals, studies. And while that is really helpful, but especially in a time, this was during the COVID pandemic, not a lot of new research was being done on this issue specifically. And I contacted Dr. Hall, who is a professor of psychology at the University of Oregon, who specializes in Asian American psychology. And he was also the president of the Asian American Psychology Association, to kind of get a firsthand experience and any new information that I might have missed. So for my interview with him, I got 3 major points of insight that will help shift from the causes to my potential solutions. One is in lower statistics. So in the infographics that I kind of showed before, as you can see, there are a lot of lower statistics. And this misconception, I kind of asked him, do Asian Americans actually have better mental health? And he states that it's probably more due to underreporting than the fact being true. He also pointed out on the same idea that there's a severe lack of information because help seeking rates are too low, and then there's very little reporting of issues and a lack of research. There's a lot of trends that experts like him cannot figure out. For instance, I asked him, is there a mental health disorder that tends to be more prevalent in a certain group of Asian Americans? And simply he replied that he couldn't answer that because they just simply don't have enough data. Lastly, he pointed out the controversy with the issue. Within a lot of Asian American communities, there's simply avoidance of the issue because it's a taboo. A lot of people don't want to talk about it. And as a result, many people do not seek help. And when people do not seek help, this leads to lower mental health seeking rates. And as a result, general society believes that mental health disparity does not exist. And this is why I will stress that there's very little, very, very, very little policy in regards to this issue that have actually been passed. Now, moving on to potential solutions, the first one that I'll propose is to conduct more research of better quality. And you can see this in the Pursuing Equity and Mental Health Act, or also known as House Resolution 5469 from the 116th Congress. And what basically this policy proposes is to allot more money to the National Institute of Health to conduct more research on not only the mental health of minorities, but also why a disparity exists in mental health research. However, I also believe that in order for this to be effective, the data collected needs to be disaggregated, which simply means to be split or to be subdivided. So instead of collecting data on this overall arching name of Asian Americans, we would subdivide that into Chinese Americans, Indian Americans, and so on, or something like Asian American ages 10 and up or 30 and up, and so on. This way we can be more culturally competent and be more detailed and specific in which data we are collecting. And after we do collect that data, we can use it to educate policymakers on minority needs. Because this data tends to be a little more detailed, we can educate them on exactly what minority needs and not just an overarching idea. However, the one downside is that it can be quite expensive, and the Pursuing Equity in Mental Health Act suggests allotting about $10 million annually to the National Institute of Health. And while this is not that much compared to other projects, right now in a society which kind of does not believe that an issue exists, this may potentially be a little difficult to find funding. Another potential solution is to reform the healthcare provider system. And you can see this in California Assembly Bill 512, in which it proposes that any California mental health plan should include a cultural competence plan. The bill itself is very lenient on what it means by a cultural competence plan, but ways to do it could include having evidence-based individualized treatment, which simply means giving Asian Americans treatments that have been based off of the experiences and data collected from Asian Americans. Another way is to reduce cultural incompetence and bias by training physicians or medical personnel, whether that is in health clinics, hospitals, or med school, to have them recognize when their preconceived notions is affecting how they might give treatment. Another way is to increase representation of Asian Americans, and especially in underrepresented fields such as psychology and psychiatry. This can be all made possible through Medi-Cal funds, as which the California bill has stated. Another potential solution is to educate and reach out to the public. And it has been suggested that in order to do so, you can campaign in communities about mental health information. For instance, you can attend Chinatown's community fairs or like gatherings, set up a booth and give pamphlets, or just simply have doctors at the site explaining what are the symptoms and where they can get mental health services in their communities. And this has been seen in the Stop Mental Health Stigma in Our Communities Act, or House Resolution 2826. If you guys are interested in policies, I would keep an eye on this policy especially. This policy has been continuously proposed since 2017, but it has been continuously shot down in a pretty much Republican dominated Congress. But with the rise in kind of Asian activism, as well as the 117th Congress, we may see it being reproposed and it being passed again. So what this policy does is that it calls for the increase in mental health symptom awareness. And one way we can do so is having medical personnel, such as doctors or physicians, doing field work, going to local community joints, such as maybe churches, high schools, etc., and having them explain the science behind psychological treatments, or simply having them getting people to understand, feel a little more comfortable talking about the issue. And finally, the last kind of potential solution is to tailor existing services to be more accessible. At the very top of my head is the idea of free health or universal insurance coverage. We all know how expensive health medical bills can be, and in the previous infographic that I showed, there is a significant number of people who are uninsured. Another suggestion is to use mobile medical clinics, which is kind of like a bookmobile, but for medical purposes. And this can be especially helpful to break down certain barriers, such as geography. These medical clinics can drive to certain areas where having hospitals or having doctors go there by itself is often not very feasible. Another suggestion that has been made is to have virtual treatment sessions through phones. And this major advantage of this is that it can be done in the privacy of personal homes. So this may encourage people who may perhaps feel a little ashamed to go into a hospital and to do so themselves. With the addition of certain add-ons, such as language translations, it can also break down other barriers, such as language. However, it has been admitted that this can be financially difficult, and a lot of insurance companies might not cover this type of medical care. So after doing all that research and learning about the basis of it, as well as what we can do, I completed my civic action with Asian Health Services and their UELP prevention program to create a collection of short stories. Before I actually show you guys the finalized project, I just wanted to really quickly run through the steps towards the project itself. So I started off by creating a Google form to collect these stories. As I mentioned before, this was done during probably the height of the pandemic. So even though I really wanted to, I was unable to go out, physically talk to clubs at my school, to go ask friends for their own stories. So, and this was a nice way to keep it short and simple, as well as anonymous if they wanted to. So you can see in the left picture, I kept it, I introduced myself, gave me what I was doing, as well as on the right-hand side, I gave a few instructions. I wanted people to keep their own stories, but then I also wanted to make sure that those who were sharing were also comfortable doing so and refrain from anything that might be a little too triggering. After that, I created visual accompaniments for each story. So on the left-hand side, those are just, I was working around with what kind of style that I wanted to be. On the right-hand side are some of the illustrations that are actually in the product itself. I kept it black and white to kind of give it a melancholy look, kind of. It is a subtle beauty to it, but it also portrays like a seriousness to this issue. And so here are just some pictures from it. So this itself is the finalized project that I did publish on Google Slides. And yeah, so really quickly, I did want to thank, once again, Ingrid. She met with me weekly while I was doing this project and really gave me kind of, directed me on which direction that I did want to go. I also wanted to thank Hao Seichao. He really helped me kind of find these policies that I presented in the latter half of my presentation, which was, once again, very hard to find. So this introduction, it was just a short and condensed version of my first half of my PowerPoint. And then I kind of explained why I was doing this. So the main point by collecting these stories, many of which are by Asian Americans themselves, I wanted people to share their own experiences, to first of all, get the community talking about the issue, but also get general society to realize that Asian Americans do suffer from mental health issues, that an issue does exist. Not only that, I hope that these stories could spread knowledge, kind of change negative point of views, and convey to those who may also be suffering that there are people out there who understand and you can talk to. So because of time constraints, I don't want to read, I'm not going to have time to read every single story in here, but I will also be sharing this link, and you can also click this link later on the PowerPoint to access this presentation. Each one of these stories are personal and individual, written by an individual, so they're all unique experiences. I really recommend you guys looking forward to them. So I'm going to read this one, which is titled Unintended Demotivation. So, words or phrases that demotivate your peers or family members should not be spoken. Unfortunately, occurrences of this continue to happen in my own household by people that do not realize the gravity and impact of their statements. If I wear a style of clothing that I haven't worn before, I will get called out for it. Or I suggest an idea that seems flamboyant, I will receive taunts that aren't meant to hurt, and yet the words sting even hours after they were uttered. Everyone should be mindful of what they say, because people are always perceiving you differently than you know. People are always fighting a battle you know nothing about, so occasional compliments will definitely brighten someone's day. Help others, be kind, stay away from unintended demotivation. So after reading the story, one of the lines that really stuck out to me was, people are always fighting a battle you know nothing about. And I kind of try to capture that on the left side, on the left-hand side here, where I drew a person fighting an inner battle in their mind. And this kind of also relates to us. We pass by so many people on our day-to-day basis, and even though on the outside we may seem perfectly fine, however, we never know what someone is going through. So this is just one suggestion of what this person may feel comfortable and how we can help others. She suggests, stay away from unintended demotivation and help others, be kind. So this one is titled Am I Enough? And this one kind of covers on the academic side of mental health for Asian Americans. With this person, she really wrote about living in a pretty academically heavy and really in a community that really stressed academics, and there was a certain pressure to live up to her parental pressures. And this one really talks about how she struggled through it and how eventually she started to get better. So if you're interested in kind of academics, mental health related to that, this might be a story that you might want to read up on. Another story that I have is titled Sorry for Sipping. And a lot of these stories are written by my peers and friends in my community, even if I don't know exactly who wrote them. A lot of them contain, for instance, will contain like youthful vernacular. A lot of them will contain words that you might see us text to friends and of that sort. We wanted to keep that in the final presentation because we thought having a variety of different ways that people write, different experiences kind of showcases that this issue does span across different people as well. So this one talks a little bit about, once again, kind of not exactly academic pressures, but kind of how we tend not to really talk about mental health and how we can start talking about it. This person also kind of elaborates on their growth, so which is kind of captured by my illustration of a butterfly slowly from a caterpillar emerging to a butterfly. This one is titled Eyes Closed, Mouth Shut, and this one captures a lot of Asian Americans' unwillingness to talk about mental health at home and how she herself experienced this in her own family. And she also in the end talks about how we can start conversations about this issue. So if this is a topic that interests you, you might want to check this story out. Another story that I have on here is titled A Balancing Act. And this one is also about academic pressures, which is a common trend among especially Asian American youth, at least in my community. While the last one kind of talked a little bit more on parental pressures, this one kind of talks about, just the stress of having so much work to do, trying to balance, getting good grades, getting good SAT scores, having all these extracurriculars, but at the same time trying to have fun, trying to take care of yourself, and especially in the time of the pandemic. This person also talked about what helped them get through their mental health issues. This one person especially elaborated on friendships and how her friends really got her through these tough times. And lastly, the last story is titled A Friend in You. And this one may be especially helpful for someone who may not necessarily themselves be struggling, but know a friend who is. It gives their own story through one of their friends, as well as gives suggestions on what you can do. And finally, I wanted to end this presentation, at least for this project, on a really happy note. So I put some pictures of my cat, she's really cute. And then I also kind of left a meaningful last message. So even if you aren't comfortable seeking out, if you want to seek out, but you're not quite comfortable doing so, you can always start out with something small. Try to cheer yourself up. When I was struggling a few years back, it was especially helpful to bake a cake, watch a few YouTube videos. You can always start small, and large steps start with small steps. And that concludes the presentation, and that concludes this product that I made for my service. And thank you. And with that also concludes my main presentation. Are there any questions? Yeah, great question. So I personally, well, because it's been quite a while since I've personally talked to quite a lot of my friends because I haven't gone to school in a whole year. But some of the strategies that I personally find helpful with talking to my friends, at least, is we'll just, one of the ways that we do get conversations starting is that we usually talk about something that we kind of found interesting online. So beginning my senior year, I kind of stated that I saw the Instagram post. Social media is a great way to get things started. Sometimes we'll just talk about, hey, are you feeling that great? Or our school has a wellness center. Do you want to go take a break at the wellness center or play a few games? That's kind of how we get conversations started to get a little more kind of action going. So this is one of the examples is I did do a collection of short stories. And one way that I feel a lot of people might be a little more comfortable with doing so is to keep it anonymous. So if you're doing a questionnaire on Instagram or something, or if you're doing a poll asking questions, you can put ballots in, keep it anonymous. At least I feel a lot of my peers would be a little more open to participating in such stuff if you were to do it that way. Let me look at the question again. I guess another way that kind of with my friends, at least who tend also to be Asian, we were able to relate on a certain note, kind of culturally as well, kind of how we had the same experiences a while back, and how both of our parents weren't had kind of different perceptions on what we felt on mental health as compared to us, and from what we've learned in school. So while she didn't really feel comfortable talking with her parents, she felt comfortable with us. And after learning a little bit more, we reached out. We started bringing up this conversation more because of how we didn't really feel comfortable talking about it at home, and how we were able to relate that same experience. Yeah, definitely. Actually, a little, yeah. So I was inspired to kind of do this presentation because of my own journey with mental health. I actually did this presentation, I feel like, after I got a little more better at communication with my parents. If I hadn't gotten better at communicating with my parents about mental health, I probably would not have done my project on this topic. So I would definitely say yes, it has improved my communication with my parents, because even afterwards, after I was done doing this, what I've been doing with this project, kind of this presentation, as well as what I was doing with school, has been kind of a topic that I've been, it's something that my parents have always been asking me about. It's like, how's your presentation going? And simply those small questions gets the conversation started about how I was feeling, and especially recently with they've been a lot more open to this area of mental health, and especially it's helped our family a lot, especially with a few of my cousins who've kind of experienced the issue themselves. So yeah, I felt very relieved, but also triumphant when they were they wanted to hear my presentation about this. So I was very happy. Thank you for coming.